At the end of the day, I don't actually believe that most people disagree as much as it's portrayed in the media or in even common conversation. I think there's a lot more that we can agree on than what we can disagree on.
Hello, I'm Faith Rogers, host of today's program, COVID-19, Keeping Up with a Moving Target. This is a December 2nd update of DKB Med Radio's Coronavirus Educational Series. Thank you for joining us. This activity is jointly provided by the Postgraduate Institute for Medicine, DKB Med, and the Institute for Johns Hopkins Nursing. Today's program is accredited for ANCC and AAPA credit, as well as AMA-PRA Category 1 credits. Please visit our website for complete CE information. If you're tuning into our webcast, please click the red Claim Credit button in the webinar console to attest for credit. Otherwise, please visit covid19.dkbmed.com. There you will also find all of our previous COVID-19 programs and have access to other free CE programs on a wide range of topics. Today's learning objectives are: discuss how the state of the public health infrastructure at the beginning of the pandemic affected the initial response to the pandemic, and describe the public health perspective on the intersection of freedom of religious expression and collective public health goals. This activity is sustained by in-kind support by DKB Med. All activity content and materials have been developed solely by the activity directors, planning committee members, and faculty presenters. With us today, we have Dr. Paul Auwaerter, Clinical Director of the Division of Infectious Diseases at Johns Hopkins School of Medicine. Today, he will be interviewing Dr. Michael Mendoza, the Commissioner of Public Health in Monroe County, New York. Dr. Auwaerter, Dr. Mendoza, thank you for your time today.
Thank you, Faith, for the introductions, and I'm just delighted that Dr. Mendoza has been able to join us, especially as the pandemic coronavirus remains so prominently in the news as we enter into the month of December. Dr. Mendoza has been wearing a very important hat as a commissioner for public health for a county, and one of the challenges has been the rather fragmented public health approach across our entire country. I mean, we don't really have a unified national health. Then we have states that sort of organize their own, and then we have at a county level. Dr. Mendoza, how can you relate to people? You're a commissioner in Monroe County, that's in the Finger Lake region of upstate New York. Right on Lake Ontario, but there's always been, as a native New Yorker, an upstate downstate tension as well. How does this work at your level as a county commissioner? Give some people of how that piece of the public health system works in the current pandemic.
Well, I think it goes without saying that this has been a tumultuous year from the pandemic standpoint, from a political standpoint, from a social and racial standpoint. But I will say that I have the luxury at some level of being at a local level, which doesn't absolve me of all of that tension, but it does afford me some latitude with regard to being approachable to the people who I serve. And so I try to approach my role from a very scientific, evidence-based, data-driven role. The minute I start walking into politics is the first minute I start regretting that I walked into politics. And at the end of the day, I don't actually believe that most people disagree as much as it's portrayed in the media or in even common conversation. I think there's a lot more that we can agree on than what we can disagree on. And I find that helpful because when I approach people about where their views are with regard to whatever piece of the pandemic we're talking about, I find that people are very amenable to changing their viewpoints when given plausible scientific evidence. Because at the end of the day, I think people are fed up with this. We want to be done with this. We want to move on to 2021 and all the good things that can bring. But unfortunately, we're looking ahead to what looks like it will be a very sobering December. So that's the tension that we're in right now.
Yeah, I'm always reminded of the quote by John Kenneth Galbraith, the economist, who I'm paraphrasing, said, when the facts change, I change my mind. What do you do, sir? For example. And I think there's a lot to be said, and of course we could parse through the facts, but as you've dealt with this from March onward, what are some of the things that you think have gone very well? And then perhaps on the flip side, this probably won't be the last pandemic, maybe for 100 years. We truly hope. Preparedness is always an important thing, but what would you wish for from learning from what we encountered over the last 9 months?
Well, it's hard to say when we're in the middle of it, but looking back with whatever perspective I can pull together, even in the middle of all of it, is I think we were prepared. I think preparedness in public health means acknowledging that at any given moment things can change, and that humility that we bring to our job, I think, has paid off in that we approach this from a very exploratory perspective at first. We didn't know very much about this at first. We had some, preconceptions, but most importantly, our plan, which was built around the pandemic influenza plan, which has rubrics that were very useful for pandemic COVID, but our plan was built around a lot of uncertainties. It was built around the fact that things can change at any given moment. And I think that's what allowed us, at least at the beginning, to close down things quickly, to be aggressive relatively early in this pandemic. There was a fair bit of luck that we enjoyed in the beginning. But I do think that humility has really proven to be very useful throughout this pandemic. Now, looking ahead, you raise a really good point. It's a certainty that we will have another pandemic, likely in our generation, hopefully not as large as the COVID pandemic has been. But I believe that this will be a wake-up call to our entire system, be it the healthcare system, the political system, the social services system, that underfunding and understaffing public health and diminishing the infrastructure for public health was an unwise choice. And I think insofar as 9/11 was a wake-up call to all of us around Homeland Security, I think COVID will be a wake-up call for all of us around public health infrastructure.
Yeah, I truly hope so. I spent a year as president for our Infectious Diseases Society a couple of years ago, and spent a fair amount of time on the Hill trying to help advocate for infectious disease-oriented funding. And, the NIH has always gotten a lot of dollars. I mean, they're glamorous, they're basic science, they're going to cure cancer. But I've always felt that the Centers for Disease Control was the Cinderella. It was a stepchild. It was always scrapping, always had funds cut. And I think it's showing, along with the idea that unlike other countries, we don't really have a unified national approach, which has led to a lot of, how should I say, difficulties. The tension, as I've seen it over the months, has always been public health, physicians where you want to save lives. I mean, that's very admirable. But then there's the economic tension where people say, look, you may not see the lives lost because of the economy and so on. But this is as important as public health, and that tension and trying to do best is what the politicians and public health officials have been trying to intersect. One more hot button topic at the moment, though, is just been the recent Supreme Court decision. I believe the way I read that said that the First Amendment rights, at least in their narrow opinion, might trump public health decisions made by the state in terms of limiting congregations to certain sizes and hot zones and so on. I think many of us in the United States, have an individualist streak. We're sort of like, look, we're in this on our own. We take care of ourselves. What's your sort of view of that decision, and how might that interdigitate with your own thoughts on public health?
Well, I think the first thing I learned is that you never want to take legal advice from a physician. So take everything I say with a grain of salt. But I will say that, we have to respect the Supreme Court at some level. They are the preeminent scholars as far as the interpretation of the law. I do think that we can find our way through this even with that interpretation. I don't find that interpretation to be incongruent with our approach and our desires in public health. And they raise good points. I mean, I think everybody has to have good checks and balances. I mean, public health should not be given free rein just because it's a pandemic. We do have to be mindful and respectful of people's individuality and personal freedoms. That being said, I learned it very early that you don't have the right to yell fire in a crowded theater. And the reality is that there have to be checks on individuality as well. And where that line falls is ultimately the question for this generation. We have lived through questions in this last 9 months that we've never needed to confront in recent memory. And so I do think that this reawakening of these personal freedoms versus collective goals conversation is a good one for us to entertain as a society. But I don't actually think that at the end of the day, the Supreme Court's ruling is either going to make or break our success through this pandemic, because I do think the personal choices in the privacy of our own homes are ultimately what's going to get us through this. And it's not the freedom to have a gathering. I think we can have gatherings if done, safely. We've had gatherings all across the country outside for many reasons across the country over the summertime that were very, very safe. So there are ways to do so safely. But I don't think the Supreme Court ruling necessarily will be a limitation on our progress as public health.
Yeah, I was wondering, as a public health official, how you might take your wise words and because I agree, there's no really animosity. I mean, public health is generally for everybody as much as possible, the common good. The sense of why should liquor stores and grocery stores remain open versus, congregations, religious activities, and so on, weddings, which might fall under this, and so on. We know those events have led to significant super spreader events that get a lot of media attention, but I think your point is excellent. There's a sense that most disease is actually acquired in the home, right? Someone introduces it into the home, unfortunately, and the average rate of acquisition might be 18 to 20%, a little higher than the flu, but there's a big range depending on household activities. But religious services, people are in one area, they tend not to move, and so on. What would be your advice then to people that are making the decisions to go to churches, that perhaps going to gatherings that may or may not be certainly in keeping with New York state law at the moment, because obviously there's not 100% regard to accepting the policy and so on?
Well, it's hard with religious freedom because it's so important. And, through difficult times like this, you could argue that faith is now more important than ever. And one's ability to exercise and express that faith is now more important than ever. And so the question really is, how can we do so in a way that is safe for the public? How an individual may or may not want to entertain risk is his or her own choice, provided that the person is understanding of the risks that they're taking. And my goal is not to tell people what to do, but to provide people with the information that they need to make a sound choice. And of course, my hope is that they will make a choice that's in the best interest of public health. But the reality is that some people choose to make unhealthy decisions. As physicians, we see this every day in the office. We've got patients who make decisions that we probably wouldn't make for ourselves, but that doesn't mean we shun them and say, please leave. We work with them, we support them, we coach them, and we hope that they'll come around to the right decision ultimately. But with public health, the challenge is that one person's unwise choices may have an impact on somebody else who's unwittingly or intentionally trying to do the right thing. And so I do find, that the creative ways to exercise faith that I've seen demonstrated across, the state and the community are worth looking into. And I have to ask, are there ways to exercise and express your faith utilizing technology or, some modicum of limitations that strikes that balance? Because it's certainly not, it's a false choice to say it's religion versus public health. That's not a true choice. But I do think we have to entertain some of these creative, different, call them unorthodox solutions, because I think the times warrant that.
Well, yeah, thank you for your thoughts on that. And maybe in closing this segment, you're sort of what I sort of think of as like the congressman. You're in a local district, as you said, you probably have more personal contact and or at least relationships with people in your county and so on. Help other physicians that may not be, and clinicians who are as familiar with public health. What's the one or two things you look for your state health department? What's that sort of interplay there? And then what about with the Centers for Disease Control? Just help people understand a little bit how each might influence what you do.
Well, in the practice of medicine, we have evidence and we have guidelines, and sometimes they don't match. And that's what makes being a clinician so challenging, is because sometimes you might find evidence and guidelines that may not pertain to your patient or to the family that you're caring for. When it came to the COVID pandemic, a lot of the early evidence was unclear. A lot of the early guidance was unclear. the CDC was not recommending in favor of masks initially. And, as a public health official, as a physician, I would never have thought to do differently than the CDC recommended. And now looking back, I wish I had. And I remember thinking, well, N95 masks, the shortage of supplies notwithstanding, that really does make sense. If everybody could wear an N95 mask or any kind of mask, wouldn't that make sense? But then, the Surgeon General and the CDC came out and said, let's not recommend, universal masking at first. And I will say that, looking back on this, if I have the luxury or burden, if you will, of having to go through another pandemic, I will look at all of the guidance with probably a little bit more scrutiny. I will not accept the CDC guidance sight unseen, if you will. And so that was one thing I learned from this. But at the state level, we look to the state health department to help us with the implementation of guidelines, of all the policies that have everything to do with how we do as a community locally. The challenge has been that every community is seeing this at some level from a different perspective. And where I feel our perspective is most important is that I can offer what we see at a local level from a data standpoint. I can tell, the governor and the health department at the state level, look, all of our transmissions have largely been in private gatherings in homes among people who are not distancing and not wearing their masks. People who are saying, well, we've got to close down, the gyms and fitness centers and the bars and restaurants and the barbershops and hair salons. Well, that's not where the majority of the problem lies. And so that the challenge, of course, is, what can we do? Because we can't close down public gatherings. That is the challenge. And so, we look at these various levels of government, but at the end of the day, we've got to find a way to interpret the data correctly and represent it accurately to people who are making the policy decisions.
Yeah, I think you make such important points because there's this fear that you may catch it from someone you don't know, but it's really the people you know that's the problem. And we let down our guard in the home because we think it's safe, it's people we know. And this virus really does take advantage of that need for human interaction. And we let our guard down in our house, which I think it's so hard to keep on alert all the time. Yeah. And I think you make a wonderful point. So Dr. Mendoza, thank you for everything that you've related today. Also all your work, of course. I think you're one of the unheralded heroes that are working across the entire country at levels here to help, especially now in this difficult winter time with this coronavirus. So thank you very much.
Thank you for your time.
Dr. Auwaerter, Dr. Mendoza, thank you again for your time today. If you're tuning into our webcast, please click the red Claim Credit button in the webinar console to attest for credit. Otherwise, please visit covid19.dkbmed.com. Any questions or issues, feel free to email us at the address listed. To submit questions, please send them to qa@dkbmed.com. That's Q as in question, A as in answer, at dkbmed.com. Again, thanks for joining us and thank you for your dedication to your patients with COVID-19.